चलो ठीक।
So, hello students, starting with this 10 Kadam series for you. 10 Kadam. Okay, so let us discuss some 10 flowcharts today. Aaj 10 flowcharts let us discuss. So, we'll first start with some nerves. Some nerves. We'll discuss the muscle supplied, the muscle supplied by the nerves in the form of flowcharts. Okay? So, let us understand the median nerve in the upper limb. Median nerve. We'll write it like this: median nerve. The median nerve. Now, students, if you can tell me, how is the median nerve formed? One moment. Okay. So, how is the median nerve formed? The median nerve is formed by joining of two roots. Two roots. What is that? The lateral root of median nerve, lateral root of median nerve, and the medial root of median nerve. Lateral root of median nerve and medial root of median nerve. The lateral root of median nerve, what is the root value? C5, C6, C7. And the medial root of median nerve, the root value is C8 and T1. C8 and T1. Right. So median nerve is formed by two roots. आज median nerve discuss करते हैं. Some flowcharts will discuss. Right. 10 का दम में. So median nerve is formed by two roots. One is the lateral root of median nerve. The other one is the medial root of median nerve. Lateral root of median nerve का root value क्या होता है? C5, C6, C7. Medial root of median nerve, what is the root value? C8 and T1. So median nerve का root value क्या होगा? What will the root value of median nerve be? It will be C5 to T1. Right? Median nerve के में सारे roots होते हैं C5 to T1. The radial nerve also has C5 to T1 roots. So what is the root value of median nerve? So it is C5 to T1. C5 to T1. Now, what are the branches supplied? I mean, what are the muscles supplied by median nerve in the arm? Chalo, we'll start it like this. ऐसे flowcharts में बनाते हैं. What are the muscles supplied by median nerve in the arm? वैसे arm में which are the muscles? एक biceps है, brachialis है, coracobrachialis है. And which is the nerve in the anterior compartment of the arm? Musculocutaneous nerve. So does median nerve supply any muscle in the arm? No muscles. So in the arm, it does not supply any muscle. No muscle in the arm. Okay, no muscle in the arm. Now let us come to the forearm. Forearm. Okay, so what are the muscles supplied by the median nerve in the forearm? One is the pronator teres, the flexor carpi radialis, palmaris longus, the flexor digitorum superficialis. Four superficial muscles: pronator teres, flexor carpi radialis, palmaris longus, and the flexor digitorum superficialis. These are the muscles supplied by the median nerve in the forearm, right? वैसे flexor carpi ulnaris को कौन supply करता है? Who supplies the flexor carpi ulnaris in the forearm? The ulnar nerve. That's the ulnar nerve. The median nerve gives a deep branch. What is the deep branch known as? The anterior introitious nerve. It's a branch of median nerve. And ये जो anterior introitious nerve है, what does it supply in the forearm? It supplies one, the flexor pollicis longus, the pronator quadratus, and the flexor digitorum profundus का lateral half. Lateral half. I'm writing in short, बच्चों. I hope you'll be able to understand this. So forearm में four superficial muscles are directly supplied by median nerve: the pronator teres, the flexor carpi radialis, the palmaris longus, and the flexor digitorum superficialis. Median nerve एक deep branch देती है. That's the anterior introitious nerve. And what is this going to supply? The flexor pollicis longus, the pronator quadratus, and the lateral half of profundus. Okay. Now coming to the hand. In the hand, what is the median nerve supply? The median nerve supplies how many muscles in the hand? Five muscles. Five muscles. Usme there are three muscles of thenar eminence and two lumbricals. Three muscles of thenar eminence. Who's that? Abductor. Chalo, I'll write this down for you. Abductor, pollicis, brevis, abductor pollicis brevis, flexor pollicis brevis का superficial head, and third one is opponens pollicis. So abductor pollicis brevis, flexor pollicis brevis का superficial head and opponens pollicis, the first and second lumbricals. So these are the muscles supplied by median nerve in the entire upper limb. Clear है बच्चों? तो median nerve का root value is C5 to T1. Arm में no muscle, forearm में 4 superficial muscle, and the deep branch of median nerve उसका नाम है anterior interosseous nerve that supplies 2.5 muscles. Who's that? The flexor pollicis longus, the pronator quadratus, and the lateral half of profundus. In the hand, the median nerve supplies 5 muscles, 3 muscles of thenar eminence, abductor pollicis brevis, flexor pollicis brevis का superficial head, opponens pollicis, the first and second lumbricals. Perfect. So if the median nerve is injured in the axilla, everything is paralyzed. सारे muscles paralyzed होंगे. If the median nerve is injured in the forearm, so the muscles of the forearm are paralyzed, the muscles of the hand are paralyzed. If the median nerve is injured in the carpal tunnel, so forearm के muscles would be spared. And which muscles will be involved? The hand muscles will be involved. अगर lumbricals paralyzed होता है, the first and the second lumbricals are paralyzed, you get a claw hand of the index and the middle finger. ऐसे. If the first and the second lumbrical are paralyzed, you get a claw hand of the index and the middle finger. इसे हम बोलते हैं partial claw hand. Clear, students? So this is about the median nerve, muscle supplied by the median nerve in the upper limb. Fine, ये एक flow chart हो गया. Now let us understand the muscle supplied by ulnar nerve. चलो बच्चों, if you can answer this, muscle supplied by ulnar nerve. Ulnar nerve. So what is the root value of ulnar nerve? Ulnar nerve is a branch of which cord? Ulnar nerve is a branch of medial cord. And it's a branch of medial cord. And what is the root value of ulnar nerve? Root value है उसका C7, C8 and T1. Root value of ulnar nerve is C7, C8 and T1. So what are the muscles supplied by ulnar nerve in the arm? Any guesses? Arm में no muscles. No muscles supplied in the arm. So in the arm, no muscle supplied. In the forearm, what are the muscles supplied by ulnar nerve? One is the flexor carpi ulnaris and the flexor digitorum profundus. Flexor digitorum profundus का medial half. Okay, so which are the muscles supplied by the ulnar nerve in the forearm? One is the flexor carpi ulnaris and second is the medial half of profundus. Now in the hand, what are the muscles supplied by ulnar nerve in the hand? Ulnar nerve बहुत muscle supply करती है. 15 muscles ulnar nerve supplies. उसमें the 3 muscles of hypothenar eminence. What is that? Abductor digiti minimi brevis, abductor digiti minimi brevis, flexor digiti minimi brevis, opponens digiti minimi, third and fourth lumbricals, then 4 palmar introsci, 4 dorsal introsci, adductor pollicis and the deep head of flexor pollicis brevis. Deep head of flexor pollicis brevis. बच्चों, the superficial head of flexor pollicis brevis is supplied by which nerve? Median nerve. The deep head of flexor pollicis brevis is supplied by the ulnar nerve. Clear? So once again, ulnar nerve is a branch of which cord? Ulnar nerve is a branch of medial cord. उसका root value क्या है? C7, C8, T1. What are the branches of ulnar nerve? I mean, what are the muscles supplied by ulnar nerve in the arm? No muscles. forearm में 2 muscles, 1.5 exactly, flexor carpi ulnaris and the medial half of profundus. हैंड में कितने मसल्स अप्लाई करते हैं अल्लाह ना? 15 मसल्स, राइट? उसमें 3 मसल्स ऑफ हाइपोथेनार एमिनेंस, abductor digiti minimi brevis, flexor digiti minimi brevis, opponens digiti minimi, third and fourth lumbricals, 4 palmar interossei, 4 dorsal interossei, adductor pollicis and the deep head of flexor pollicis brevis. Perfect. अब इनमें से which muscle is known as the graveyard of ulnar nerve? Graveyard मतलब after supplying this 15 muscles in the hand, the ulnar nerve goes and ends in a muscle. वो bury करता है, it buries in a muscle, and that muscle is adductor pollicis. So adductor pollicis is known as graveyard of ulnar nerve. Graveyard of ulnar nerve. ठीक है बच्चों, clear to all of you? So we are just discussing 10 का दम series है ये. इसमें we are discussing some important flow charts. So I've told you the muscle supplied by median nerve in the upper limb, muscle supplied by ulnar nerve in the upper limb, right? चलो एक दूसरा फ्लो चार्ट डिस्कस करते हैं, composite muscles in the body. कोई बोल सकता है ये composite muscles, composite or hybrid muscles, composite or hybrid muscles in the body. अब what are composite muscles? Composite muscles वो होते हैं which receives a dual nerve supply, a double nerve supply. 2 nerves supplying one muscle, we call such a muscle as a composite muscle. Any guesses? Come on बच्चों, guess करिए. In the upper limb, which are the composite muscle? We have got this upper limb में we have got this pectoralis major and pectoralis minor. Any guesses? Nerve supply बोल सकते हो बच्चों? Any guesses? Nerve supply of pectoralis major and minor? That's a medial and lateral pectoral nerves. Medial and lateral pectoral nerves. Second, which is the other composite muscle? एक pectoralis major minor हो गया. Second is the brachialis. Brachialis. Let us go in a sequence. Brachialis का medial half, lateral half. So medial half of brachialis is supplied by the musculocutaneous nerve. The lateral half of brachialis is supplied by the radial nerve. Medial half is musculocutaneous nerve, lateral half is radial nerve. Number 3 is the flexor digitorum profundus. Flexor digitorum profundus. This is a muscle in the forearm. Flexor digitorum profundus का nerve supply क्या है? Any guesses? बोलो बच्चों, if you know this. Medial half, lateral half. So medial half is supplied by which nerve? We've just seen this ना, अभी देखा है हमने. The medial half is supplied by ulnar nerve and the lateral half is supplied by the anterior interosseous nerve. Anterior interosseous nerve, which is a deep branch of median nerve. Okay, so flexor digitorum profundus, lateral half is supplied by anterior interosseous nerve, which is a branch of median nerve. The medial half is supplied by the ulnar nerve. And the last muscle, composite muscle in the upper limb, is flexor pollicis brevis. Flexor pollicis brevis का superficial head and deep head. Superficial head is supplied by median nerve and deep head is supplied by the ulnar nerve. Superficial head is supplied by median nerve, the deep head is supplied by ulnar nerve. So these are the composite muscles in the upper limb. Clear है बच्चों ये? हाँ? A muscle which receives a dual nerve supply is known as a composite muscle. So इसमें एक है pectoralis major and minor, brachialis, the flexor digitorum profundus, and the flexor pollicis brevis. That's a muscle of thenar eminence. Flexor pollicis brevis. Up coming to the muscles in the lower limb. Yes, any guesses? Which is the muscle in the lower limb which receives a dual nerve supply? जिसको दो nerve supply करते हैं. So one is pectineus. Pectineus, medial half, lateral half. Medial half, lateral half. So medial half of pectineus को कौन supply करता है? Obturator nerve. Obturator nerve. Which division? Anterior division. Anterior division of obturator nerve supplies the medial half of pectineus. The lateral half is supplied by femoral nerve. femoral nerve का trunk. The main trunk of femoral nerve supplies the lateral half of pectineus. ठीक है बच्चों? Now, the next composite muscle in the lower limb is adductor magnus. Adductor magnus के दो parts होते हैं. One is the hamstring part, and the other one is the adductor part. Adductor part is in the adductor compartment. So the hamstring part is supplied by the tibial part of sciatic nerve. Tibial part of sciatic nerve, and the adductor part is supplied by the posterior division of obturator nerve. So adductor magnus का hamstring part, the one which lies in the posterior compartment of the thigh, that is the hamstring part of adductor magnus. इसे कौन सप्लाई करता है? This is supplied by the tibial part of sciatic nerve, and the adductor part which lies in the medial compartment of the thigh, इसे सप्लाई कौन करेगा? The posterior division of obturator nerve. Posterior division of obturator nerve. ठीक है? The next composite muscle is biceps femoris. बच्चों ये बहुत इंपॉर्टेंट है. Biceps femoris का long head and short head. Yes, any guesses, bachcho? Any guesses? Long head is supplied by whom? Long head is supplied by the tibial part of sciatic nerve. Tibial part of sciatic nerve. The short head is supplied by the common peroneal part. Common peroneal part of sciatic nerve. ठीक है बच्चों? So these are the composite muscles in the body. Upper limb and lower limb. बस ये याद रखना. This is extremely important. This is asked in Vivas. This comes as a short note also for you. ठीक है? तो बच्चों 10 के दम में आज हम डिस्कस कर रहे हैं median nerve, muscle supplied, ulnar nerve, muscle supplied. हमने composite muscles भी डिस्कस किए. Composite muscle is a muscle which receives nerve supply from two nerves. So composite muscle upper limb के, composite muscles in the lower limb. ठीक है? One is pectineus, one is adductor magnus, and the biceps femoris. Clear है बच्चों? Okay, so now let us discuss something else. Some other flow charts. So, if anyone can tell me, look, ये first rib है. That's the first rib. What is this artery which crosses the first rib? ये artery है ना first rib को cross करते हैं, it comes down here. So what is this artery? That's the subclavian artery. That's a subclavian artery. Subclavian artery left side पे begins from the brachiocephalic trunk. Right side पे subclavian artery is a branch of arch of aorta. पता है ना ये देखो ये arch of aorta है, ये common carotid है left, ये left subclavian. This is the right common carotid and that's the right subclavian. So this is the left subclavian artery. This is the left common carotid. This is the right common carotid. That's the right subclavian. तो इसका नाम क्या है? That's a brachiocephalic trunk. ये है brachiocephalic trunk. So बच्चों, the left subclavian artery directly कहाँ से arise होती है? It arises from the arch of aorta. On the right side, the right subclavian artery is a branch of the brachiocephalic trunk. Brachiocephalic trunk. Okay. अब दोनों subclavian arteries, they are going to cross the outer border of the first rib. They cross the first rib. They come into the axilla. अब ये बनेगा axillary artery. Axillary artery. Clear है? So the left subclavian artery arises from the arch of aorta. That's the arch of aorta. The right subclavian artery arises from the brachiocephalic trunk. Both the subclavian arteries would cross the outer border of the first rib and become the axillary artery. ठीक है बच्चों? Now what is this muscle? ये first rib है. यहाँ पे एक tubercle है. There's a tubercle here. What is the name of this tubercle? Scalene tubercle. And what is this muscle? This is scalenus anterior. That's a scalenus anterior. And ये जो scalenus anterior है ना, it lies in front of the subclavian artery. This scalenus anterior is going to divide the subclavian artery into three parts. So which are those three parts? This is the first part. Origin से muscle तक, from its origin to the muscle. That's the first part. Second part is behind the muscle. The third part is after the scalenus anterior to the outer border of the first rib. Outer border of first rib. So first part, second part, third part. Clear hai? First part is before the muscle, second part is behind the muscle, third part is after the muscle. The subclavian artery is divided into three parts by the scalenus anterior. What is this muscle here? That's the pectoralis minor. And this muscle is the teres major. Teres major. What is this artery, बच्चों? What is this artery now? This becomes the brachial artery, है ना? ये बन गया brachial artery. What is this now? From here till here. What is this now? That's the axillary artery. अब axillary artery is a continuation of the subclavian artery, बराबर? At the outer border of the first strip. Axillary artery का क्या बनेगा? Brachial artery at the lower border of teres major. ये जो teres major muscle है ना, below this teres major, अब ये axillary artery बनेगा brachial artery. समझ में आ रहा है ये? Right? So axillary artery is divided into three parts. By which muscle? Pectoralis minor. ये जो pectoralis minor है, that divides the axillary artery into three parts. First part, second part, third part. Now what are the branches of the axillary artery? पहले axillary artery के branches देखते हैं, then subclavian artery के branches देखते हैं. ठीक है? This much will do for today. Clear बच्चों? So axillary artery is divided into three parts. Axillary artery is divided into three parts by pectoralis minor. Pectoralis minor. Okay, so what are the branches of the axillary artery? First part, second part, and the third part. First part, second part, and the third part. What are the branches of axillary artery? First part का एक branch, name superior thoracic artery. Superior thoracic artery. Second part के दो branches. One is the lateral thoracic and thoracoacromial. Lateral thoracic and thoracoacromial artery. And third part के तीन branches. Out of these three branches, two are going to wind around the humerus. जो artery wind करता है उससे हम क्या बोलते हैं? Circumflex. So one winds from front, anterior circumflex. Winds around what? Humerus. So anterior circumflex humeral, posterior circumflex humeral. Okay, so one is anterior circumflex humeral, posterior circumflex humeral, and subscapular artery. The last artery is the subscapular artery. ठीक है बच्चों, तो ये याद रखना आप. This is very important. What are the branches of axillary artery? ये clear है बच्चों? Axillary artery is from where to where? उसका extent क्या होता है? From the outer border of the first strip to the lower border of teres major. Outer border of the first strip to the lower border of teres major, वो है axillary artery. देखिए, from the outer border of the first strip to the lower border of teres major, this much is our axillary artery. इसके तीन parts बनते हैं. By which muscle? Pectoralis minor. तो ये होगा उसका first part. Muscle के पीछे is the second part, and that's the third part of axillary artery. First part gives one branch, नाम superior thoracic. Second part के दो branches, lateral thoracic and thoracoacromial. And third part gives three branches. What are those three branches? Anterior circumflex humeral, posterior circumflex humeral, and subscapular. Right? Anterior circumflex humeral, posterior circumflex humeral, and subscapular. बस ये याद रखना है आपको. So this is a flow chart about axillary artery. Perfect है बच्चों? Clear? So जैसे axillary artery is divided into three parts by the pectoralis minor, similarly the subclavian artery is also divided into three parts. By whom? Scalenus anterior, right? So I just mentioned this here. Subclavian artery is divided into three parts by scalenus anterior. Subclavian artery is divided into three parts by scalenus anterior. So first part, second part, third part. तो इसके branches क्या है, कैसे याद रखोगे? How do you remember this? Just remember vitamin C D. Vitamin C D. So VIT first part का है, C is from the second part, D is from the third part. So what are the branches of subclavian artery? First part is VIT, second part is C, and third part is D. So what is V? V is vertebral. V is vertebral. I, internal thoracic. Internal thoracic. And T is thyro cervical trunk. Okay, so तीन branches clear है. VIT is clear. V is vertebral. I is internal thoracic. T is the thyrocervical trunk. ये जो thyrocervical trunk है ना बच्चों, it should actually be known as thyroscapulocervical trunk. Thyroscapulocervical trunk नाम है उसका thyrocervical trunk, but you remember it as thyroscapulocervical trunk. तो thyroscapulocervical trunk के तीन branches, one to the thyroid, one to the scapula, one to the cervix. Cervix is the neck. So to the thyroid is inferior thyroid. Thyrocervical trunk के तीन branches. One is inferior thyroid, one is suprascapular, and the third one is superficial cervical. Okay, so inferior thyroid, suprascapular, and superficial cervical artery. These are the three branches of thyrocervical trunk. So V is vertebral, I is internal thoracic, 3 is thyrocervical trunk. उसके तीन branches, inferior thyroid, suprascapular, and superficial cervical. What is C? C क्या है? C is the costocervical trunk. Costocervical trunk. So costocervical trunk के दो branches है. Trunk है ना? So there are two branches. One is the superior intercostal artery. Superior intercostal artery, and the second one is the deep cervical artery. Superior intercostal artery and the deep cervical artery. And what is D? Third part say D is dorsal scapular. Dorsal scapular artery. Okay, so this is a very easy way to remember the branches of subclavian artery. Some books है ना, some books superficial cervical को mention करते हैं transverse cervical. Transverse cervical, right? So branches of subclavian artery के तीन parts बनते हैं. By the scalenus anterior, first part is before the muscle, second part is behind the muscle, third part is after the muscle. First part के तीन branches VIT, vertebral, internal thoracic, thyrocervical trunk. Second part की branch is C, costocervical trunk, and third part is D, that's a dorsal scapular. Thyrocervical trunk is three branches. One is to the inferior thyroid, second is suprascapular, and third is superficial cervical. Costocervical trunk के दो branches. One is the superior intercostal artery and the deep cervical artery. ठीक है बच्चों, my dear children, समझ में आ रहा है? Are you able to follow this? Yes? Okay. So ये आज के सीरीज 10 के दम में we are discussing some important topics, some important flow charts. So we have studied the median nerve, ulnar nerve, we have studied the branches of axillary artery and the branches of subclavian artery. ठीक है बच्चों? I hope you are able to follow this. और क्या पढ़ते बोलो? और क्या चाहिए आपको? Okay, I'll tell you. Obturator nerve बोलो, एक obturator nerve. We'll discuss the obturator nerve, or this much is enough for today. This much is enough for today. तो है ना 10 का दम ये सीरीज है, इसमें some important topics we'll discuss बच्चों as a YouTube series. Okay, so this much is fine for today. Anything else? Cuboidal fossa. What are the contents of cuboidal fossa? From medial to lateral, one is the median nerve. Second is brachial artery with its two branches, the radial and ulnar artery. Third is tendon of biceps, and the fourth is a radial nerve. Okay, so bachcho, fine, this is enough for today. So meet you once again in 10 ke dam. series. Thank you. Thank you to all of you. Thank you.